You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, weight loss and metabolism. With us today, we have a nutritional expert who has a PhD in nutrition, and her focus is metabolism and weight loss. This you got to see. We'll be right back.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, weight loss and metabolism. With us, we have Trudy Ekstrom, PhD. Dr. Ekstrom specializes in metabolic disorders and healing your metabolism. Dr. Ekstrom, welcome to the show.
Thank you so much. I'm so delighted to be here on the Wellness Hour.
Well, thank you. Now, healing your metabolism. What do you mean by that?
We have two sides to metabolism. Metabolism is how you use your energy. You have the building up side of your energy, and you have the using up side of your energy. And we can correct that metabolism if it's damaged.
So people that have been yo-yo dieters, there's damage that has been done. Is that what you're saying?
Yes.
You could turn that around?
Through years of improper eating and lifestyle choices, that's damaged the building up side of your energy, so you're not building up so much energy, or damaging the using up side so you're not able to use your energy. Those habits can be changed, and then those habits affect the hormonal levels, major hormones like insulin and cortisol, adrenaline. Those are the things we have to look at to correct a damaged metabolism.
Okay, let's begin with your background, training. People always want to know who is the person that is on the show.
Yes.
And according to my notes, you have a master's degree in nutrition.
Yes.
Then you went on to get a PhD in nutrition.
Yes.
This seems to be your passion. Tell me about that. How'd you get involved?
I was very ill. And when you have an illness, you like to read about nutritional subjects more than when you're healthy. When you're healthy, you don't really care much. But I was very ill in my early 30s. I had 5 different diseases, 5 different maladies from 5 different doctors, and I was taking 5 different drugs every 4 hours. And this went on for 2 years. I had asthma, heart palpitations, migraine headaches. I had narcolepsy, where I fell asleep anytime, anywhere. And I had severe PMS. It lasted like month-long of irritability and bloating and things like that. So those drugs were part of my life. And I was to be on those drugs the rest of my life, said the medical doctors. Well, I was interested in finding out what can I do naturally to change my own self. And that's where I started reading books. And
did you already have a master's degree in nutrition at the time?
No. I was a piano teacher and voice teacher many years ago. It's 20 years ago. Wow,
so in pursuit of figuring out your own health.
Yes.
This is what got you.
And my children. They had asthma, colic, ear infections, ADD. I was at a loss. Our family couldn't even experience a happy life. We were too busy taking our medications. I had a chart on the refrigerator with this child needs this, and I need this, and this one, this one's due for this. I was more of a nurse than a mother.
So what did you do? You tapered off all of those things over time?
Well, I found a 6th doctor. I got very stiff, so my body was in pain all the time. And I told the person next to me at a function, I can't turn your direction because I've been this way for weeks. I am so much in pain. She says, why don't you go to my doctor, who's a holistic doctor, and he helps all the Vikings football players in Minnesota. And I said, okay, well, what's a 6th doctor? I'll try a 6th doctor, okay. And he's the one who started telling me, you need to not eat these foods. You need to eat these foods. I'd never heard of some of the foods he was telling me to eat. I didn't know what a lentil was. But I did what he told me to do. I found out that those foods were actually causing some of my symptoms, which drove me to the doctors to get those prescriptions. But when I backed off the foods, I withdrew from those, I was able to withdraw from the drugs. I went to the doctor, went to the asthma doctor. They said, you need a less dose. Instead of having lungs like a 10-year-old, you now have the lung power of a 15-year-old. And eventually I was getting full lung power with my asthma. So as I withdrew from one, I withdrew from another, and I got better and better. Then my brain cleared up. I was able to think better. And it was such a revelation to me. My whole family got better naturally that I wanted to read everything I could. And eventually when my children got older, I went back to school. I said, I still, 20 years later, I still want to read more. I might as well go to school in it. So I spent 3 years getting a master's degree, 3 years then getting a PhD. And I still go to school. I still am doing seminars.
I saw you at an endocrinology conference. That's where we met.
Yes.
So you're on. So let's then move on to your practice. You're a doctor, Dr. Ekstrom. I thought it was nice that you said, I don't want to give people the impression I'm a medical doctor.
Right.
But your specialty is nutrition. And you work with medical doctors, is that correct? You refer to them, they refer to you.
That's right.
But you, again, based on my research about you, you're a women's health doctor.
Yes.
You work with people with hormonal problems, weight loss issues, metabolic disorders. So tell me, who is your patient? Who's the typical person that goes to see you, the client?
I would like to say I have a typical, but there's such a wide variety of people. I see children with ADD, overweight children, underweight children, teenagers with eating disorders. I see men and women of all ages looking to lose weight. They have fibromyalgia or chronic fatigue syndrome, autoimmune disorders of varying degrees, and elderly people with Alzheimer's, osteoporosis, a lot of menopausal problems, degenerative diseases of aging, digestive disorders from age 5 to age 95. So I don't really have a typical patient. I would say I have more that have metabolism problems that are having trouble losing weight than
everybody's
any
trying
other
to lose
category.
weight these days, it seems like. Whether it's that last 10 pounds or 100 pounds.
Yes.
This is a big part of your practice. You work one-on-one with these people?
Yes, it has to be one-on-one because everyone is different. I don't see two tests come back the same. When I do metabolism testing and investigative work on their chemistry, a husband and wife can eat the same foods for 15 years together. One has a damaged metabolism, one has a healthy metabolism. One is ready to lose weight, one is not ready to lose weight. Their body will not respond.
So what do you say to the person that they've tried everything? Yo-yo dieters, they've tried over-the-counter remedies, hormones. I mean, what do you say to them? I mean, do you offer them hope? You can help them
Absolutely,
lose weight?
because they can't give up. If they've tried everything and they haven't tried to change their metabolism, then they haven't tried everything.
The word jumpstart your metabolism. Can you offer that?
I don't jumpstart metabolism like the people do that say take this appetite suppressant, which will jumpstart your metabolism because it's got that cortisol going and you're feeling great. You don't have to take food for energy. However, in the long run, 5 years from now, you'll be coming to see me to change your metabolism. It will be worse off in the long run. So jumpstart your metabolism, it's not a jump start as much as it is easy. Put that accelerator nice and slow, nice and steady to get into that flow of traffic.
Can you convert somebody from maybe a sluggish metabolism into a faster through lifestyle behavior? I mean, what are you doing?
We have to change the habits. See, hormones affect the building up side and the using up side of that energy.
Okay.
And the habits are what affect the hormonal responses. So it's really the habits of your daily life that are affecting the metabolism via using that hormonal system. So all of the habits that you have, how you are sleeping at night, do you have a high-stress job, are you eating properly, do you eat too much, do you eat too little, are you skipping breakfast? All of those kinds of things feed into your daily habits, and all of those affect your hormonal imbalance. I mean major hormones like the insulin and cortisol and adrenaline.
You're addressing those things?
Yes. When those
How
hormones...
do you do that? You're not a medical doctor. You're taking lab work? What are you doing?
Yes. When we look at metabolism tests, I'm looking at a medical blood work, I'm looking at insulin, and I'm looking at a cortisol test. I combine that with an organic acids test, which is a urine test. And that tells me nutritionally the foundation of your body. What are you missing?
I'm sorry, but give me an example of what a urine test may tell you. Somebody's 70 pounds overweight, you do a test and bingo. Give me an example.
The urine test, the organic acid urine test, not all urine tests, but this particular metabolism for organic acids tells me, is your liver being able to detoxify you well, or is it having trouble? Are you able to absorb your proteins and break them up into amino acids and use them in your body, or are they just going through, not being used? Are you taking your vegetables and taking those carbohydrates and using the nutrition out of them? Are you burning your fats and using your fats properly? Are you getting any energy out of your citric acid cycle, which is your digestive system? Or are you just being filled up and it's not doing you any good? Do you have yeast or bacteria imbalance in the intestinal area. There's a lot of different areas like this that point toward, I might have a damaged metabolism.
So you go to the underlying cause. I mean, we talked about this on the telephone. I hear a lot of people talking about that, and I feel like it's lip service sometimes. Is it lip service for you?
I work on underlying causes. That's what I do. I'm a detective, a nutritional detective, to find out how to fix your body.
But is it livable? See, here's the thing. It seems, in my observations, that people know what to do and they don't do what they know. So what leverage, or how do you turn that around?
Sometimes we have to use supplements while they're in the healing stage. It takes a while. You're eating different foods. We've got you on a different sleeping schedule. We're helping you sleep more. We've detoxed you from some chemicals. There's 5 different areas that we have to look at. Your toxic chemistry, have to taper you off of those chemicals. And then we have to look at your exercising. Are you over-exercising or are you under-exercising? Do you have hormonally balanced exercise? And do you need hormone replacement therapy? That's bioidentical hormones. If you're missing a hormone, we need to replace it and give you a bioidentical hormone.
We're going to take a quick break. We come back, what you're doing. Take me through the process. Somebody that's watching this, 10 pounds overweight, 30 pounds overweight, or 100 pounds overweight, what you're doing to heal their metabolism, increase it, get them fat burning and fat loss, I guess, is the goal. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with nutritional expert, PhD in nutrition, Dr. Trudy Ekstrom, and we're talking about metabolism and weight loss. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
I have a canker sore. Want to see?
Oh, yeah.
Canker sores are not a little problem.
Boom, boom.
They mean throbbing,
I am good.
stinging, burning.
It's so bad, I can't even think straight.
And as soon as one canker sore goes away, another comes along.
Wasn't I just here last week?
Who can I ask for help?
Your dentist.
I didn't think about that.
Ask your dentist about Apthosol, the first and only prescription treatment just for canker sores. Apthosol is clinically proven to heal canker sores 72% faster and relieve 90% of the pain. Just apply a small amount of Apthosol and canker sores can begin to disappear in just 3 days. You may feel some minor pain or stinging when you first apply it.
Ask your dentist or dental hygienist about Apthosol.
Apthosol, the first and only prescription just for canker sores.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, metabolism, how you can speed it up, start burning fat, with Dr. Trudy Ekstrom. Dr. Ekstrom, now, your practice in Las Vegas?
Yes, I've been in Las Vegas for 6.5 years doing nutrition work for full time.
Now you see people Monday through Friday, they call you, they get a consult. How does that work?
They come and see me on one-to-one basis. I ask them questions. I have a questionnaire for them where I have to know details about their lifestyle, how they're living. And then I give some suggestions as to maybe 1 or 2 different kinds of tests we would do to discover where the answers lie.
Like blood work, urine, things like that?
The reason I can do that as a PhD and not an MD is because I work with MDs. I have a medical director, and I work with other medical people, and they refer to me and I refer to them. Gastroenterologists and DOs and all kinds of
Many medical doctors don't want to really deal with the diet end of it. So that's where you come in. Is that right?
It's time consuming. These are long appointments. I can't see someone for 5 minutes and have a suggestion for them. I have to delve into their lives. I have to ask them detailed questions. And then to give the answers are numerous. If they have food sensitivities, food allergies, take this out of your eating plan. Take this. We get precise for you. So it's not a one-size-fits-all. It's what is your body telling me we need to change in your chemistry.
Okay, you say you don't have a one-size-fits-all. You also speak in terms of people have different levels of damage to their metabolism. Clarify that.
Because there's a wide variety of problems. I get dancers that want to lose 10 pounds in one spot. I get pregnant people that want to have a healthy pregnancy plan. I have children that are hyperactive. I can't give the same menu plan.
But aren't
for
they all
the
doing the
people.
same thing? Eating less, exercising more?
Oh no, they're all doing different things.
Really?
Yes, they have a different amount of proteins, fats, and carbohydrates in all of their meals. You may be a 40-30-30 person. This person may be a 20-40-60 person.
You're talking about ratios between carbohydrates and fats?
Yes,
Okay.
yes. Each eating plan is made up with proper relationship between proteins, fats, and carbohydrates. And there are many eating plans for different maladies.
What frustrates you, by the way, nationally when it comes to perceptions about obesity and weight loss that you see going on?
Well, I think that not everything's being addressed. Americans are getting fatter and fatter because the 5 things that we cover in my clinic are not being covered in America. Do they have proper nutrition? Are they having bad food or foods that they're sensitive to, that they're retaining water from because they can't digest it well? They're retaining water from that. Are they having stress in their life and not sleeping well? Are they taking chemicals that are toxic to their system, so they're retaining water from that? Are they over-exercising or under-exercising, so their metabolism is ruined from that? And are they missing hormones that they needed to have replaced, bioidentical hormones? Those are 5 different areas that are not being covered. And one of those areas, or all 5 of those areas, can be a problem with Americans. So when we see little ads on TV saying, well, we're pinpointing this area, we're pinpointing this area, take this pill for this and take this pill for that.
Okay.
That's minor. Weight loss is a minor thing if we don't have your undergirded health taken care of, your undergirding of your metabolism and your energy taken care of.
Do you have people that have lost weight, that have kept it off a couple of years,
Oh, yes.
that turn it all around?
Oh, definitely.
People that were a mess?
Oh, definitely. I get flowers. I get music writers write me music because they have a completely different life now. And that's my story too. When you have energy, that's what metabolism is all about. That's what health is all about. You can see a person right away in their eyes when they don't have any energy, start to look sick. And that's the first thing that goes, is energy. So a healthy person is going to have that spark. You can change that around in your body. You can have a different makeup of your body chemistry.
Okay, you say this. You say you shouldn't lose weight to get healthy. You should get healthy to lose weight.
That's right.
What is that?
You have to have a healthy metabolism in order to respond correctly to any changes we make. Then you can lose weight. You don't lose weight to become healthy. Just because you lose 100 pounds, you may look healthier from the eye, but inside, 5-10 years from now, you come to me with chronic fatigue syndrome, fibromyalgia, any kind of autoimmune problem. We didn't correct the metabolism. I've had people say, I've lost 100 pounds in the last year and a half, but I wish I had it back because I cannot get out of the house. I'm so exhausted. I can't put one foot in front of the other.
You can turn that around?
They didn't heal the metabolism first, and that's what we have to do.
Is that what you do?
That's what I do.
You see that?
Yes.
So you deal with people. Now, I find this with myself, but you know, when I'm in discussions about weight losses, people will tell me they can't lose weight the way they used to lose weight. That means what used to work just 3 years ago doesn't work today. Explain that. Why does that happen?
Because the imbalances of the hormones are not correct. Their metabolism was never corrected in the first place. Weight loss and weight gain is a side effect. It's a symptom, along with other things like fatigue and other problems that you have. That's minor compared to getting the energy right for your body. When you're balanced hormonally, and you're balanced with the nutrients of your body is going to correct itself. You're going to have ideal body composition between fat and muscle. You're going to have your hormones in balance. You're going to have healthy energy in balance. Everything will be the way it's supposed to be for your particular.
Would you characterize your program as low carb or high protein or like Atkins style or the zone? What is it? Or just calorie counting?
Well, it's certainly not calorie counting. I do like carbs in with your eating plan. I don't throw out all carbs, but I do like Atkins because a lot of people that are former Atkins people will come and see me and say, I've lost 30 pounds and now I'm on a plateau. What do I do? I used to not know what to do. Why are they on a plateau? Why are they stuck there? What happened in midpoint? What happened is they didn't work on the metabolism, and that's where we start then working on metabolism.
But these active dieters, it works sometimes. I mean, I see people that lose 50 pounds, 60 pounds. I will tell you, I don't see these people without a shirt. They do seem to get stuck. So what do you do for those Atkins dieters that are stuck? Can't get that last 15 pounds or 30 pounds.
We make sure that their insulin level is correct. Not too high, not too low. We make sure their cortisol level is in balance with that insulin level. Not too high, not too low. And their adrenaline. When we look at their medical blood work and we look at their organics test, see exactly where they need help. They need glutamine. They need carnitine. They are lacking the B vitamins, which is not feeding into the adrenal glands. And that's where we can say, for a couple months now, we want you to take these supplements, we want you to eat this way, and then we'll be ready to lose more weight. It might take a little bit.
Are you body fat testing?
We do body fat testing. Some people want to know their body fat. Some people don't want to know their body fat. Some people don't want to step on the scale. And I recognize that's okay. If you don't want to, you don't want to know your body fat and you don't want to know your weight, that's okay.
But as a practitioner, do you want to know?
I like to know because I like to compare, because in a couple months we're going to see numbers. We're going to see results. But some people are actually going to psychologists, and the psychologists are saying, because of the eating disorder, whether it be over or underweight, we want to not look at the scale. We don't care what the scale says. So I have to be willing to work with practitioners that are helping them psychologically.
Well, this sounds complicated, though. It can, a little bit. You're talking about good fats and damaged metabolism and hormones. How do you put it all together? How do you make it easy to follow? Do you? Is it easy to follow? Would you say that?
My program's easy to follow because I tell you exactly what you need to do and when we need to do it. We start off with detoxification. We do that for a few weeks, then we go on to the next category and next category, whether it be the stress or the eating plan has to be first. We always start with the nutrition things first. It's always nice to get a sensitivity, food sensitivity or food allergy panel done to make sure that I'm not giving you what I think is the best advice, but you're allergic to broccoli, you're allergic to strawberries.
So you deal with food allergies?
Yes,
okay.
Yes. I like to do that, one of the first things. But after the nutritional area and looking at supplements that we can help you with your deficiencies, then we go on to that stress area and look at sleep. Sleep is a big one, especially in Las Vegas.
Sleep. How can that affect metabolism? Make somebody fat? You mentioned that.
Because stress hormones that are released are going to hold on to fat if they're not in balance. And that's what happens when you lack sleep. You're going to have more stress hormones released. It's going to hold on to that fat.
So how do you turn that around? I mean, some people just don't sleep a lot. And which brings me to the next question about sleep. How much should they sleep?
They should sleep 8 to 10 hours, depending upon their age, depending upon if they can or not. We have to help them sleep. There are some things that help sleep, and we can help you sleep.
Would you say that's one of the first things you do, is take care of sleep? Somebody comes to you, 6 hours of sleep?
That's the second thing I do. After the nutrition, then we go into the sleep area and the stress area. Some people just have high stress jobs, so the cortisol, the adrenaline from the stress of the job is too much. And we have to try to calm them down and get the insulin to be balanced with that high stress job of the cortisol.
So the main thing is you can take care of it.
The main thing is it has to be addressed.
Dr. Ekstrom, we're going to take a quick break. We come back, the weight loss supplements or supplements that help metabolism, and also more about the nutrition, some tips, some take-home advice for people watching this. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Trudy Ekstrom, PhD, expert in nutrition here in Las Vegas, getting amazing results with her patients. We'll be right back.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about damaged metabolism with Dr. Trudy Ekstrom. Okay, Dr. Ekstrom, you told me that oftentimes you're the last resort for people that want to lose weight. What do you mean by that?
They'll come to me with their previous history, slam it down on my table and say, I have done appetite suppressants, I have done exercise, I have done Atkins, I've done South Beach, I have done the Zone. I've lost 5 pounds in 2 years of help of trying to do this. You're my last resort. If you can't help me, I don't think anyone can help me. And I'm glad to be their last resort. At least they haven't totally given up. I would like to be their first resort.
That's good.
But I'm the last resort, and I'm happy to be last resort.
So what do you say to the person, they're on the couch, they've seen this, and they're still skeptical? You know, they don't know for sure if you can do something about it.
I say, call me. I say, let's get together. If you're willing to work one-on-one with me, and we can be a team, and you're willing to at least come in and find out where your metabolism is, then we can be a team and work it out together. If you just sit around, you're not going to find any answers.
Results.
It's going to continue. Yeah.
You're offering results?
Yes, that's the goal. That's the goal. Results with weight loss, results with energy. That's what we're looking for. So we can get you healthy. Yes, and you will feel better.
Very interesting. We're going to have you come back because, I mean, obviously this is a big subject.
Yes.
So I want to thank you for coming on the show.
Thank you so much. I'm so glad to be on the Wellness Hour.
Thanks. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.